Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Dr. Nishi Bhopal is triple board certified in psychiatry, sleep medicine, and integrative holistic medicine. She graduated from the University College Cork School of Medicine, completed her psychiatric residency at Henry Ford Health System, and a fellowship in sleep medicine at Harvard Medical School. She also received training through the Maharishi Ayurveda Association of America and the Integrative Psychiatry Institute. Well, Nishi, thank you for being here. Thank you for visiting with us today. Welcome.
Thank you for having me. It's a pleasure to be here.
I like to ask people how they got started in their particular line of work and what it is that drives their passion. So how would you respond to that?
Yeah, so I'm an integrative psychiatrist, and I also specialize in sleep medicine. And when I was in medical school, I didn't intend to become a psychiatrist. I actually thought I was going to be a pediatrician. I kind of took this circuitous route. So I thought I was going to go into peds. And then when I was in my medical school rotations, I became really fascinated with physiology. And so then I thought I was going to go into internal medicine. So I actually started out my residency training in internal medicine. But while I was doing my rotations, I found myself talking to all my patients about what was going on in their lives and how they were feeling and what was happening in their relationships and did they enjoy work. And, all of these kinds of things that you don't have time to delve into in a 15-minute clinic appointment in the internal medicine setting. And so I kind of came to this realization that maybe I picked the wrong specialty. And I ended up transferring into psychiatry after my intern year in internal medicine. And then when I was in my psychiatry residency, I was seeing so many patients with sleep issues, either insomnia or oversleeping. And I felt like I didn't have a good foundation in how to help them. And part of the reason I was so interested in sleep as well is because of some of my own issues with kind of sleep and fatigue and learning how to manage that with yoga and meditation and diet and nutrition and all of these other holistic modalities. So it kind of became this convergence of my clinical work with my own personal experiences. And that led me to pursue integrative psychiatry and sleep medicine and bringing in elements of Ayurveda and yoga and all of these other things. And so that's kind of how I practice now.
So do you work out of a clinic or a private practice? What's your setting?
So my setting is currently a private practice. I also work with a group practice, but now I'm focusing more on my private practice. And so my private practice is based in the Bay Area. I'm in California, and it's called Balance Integrative Psychiatry. And so I focus a lot on holistic approaches to mental health, integrative approaches. So bringing in conventional psychiatry and using medications and things when appropriate, but really looking at other ways to help people achieve optimal health and optimal mental health, and helping people wean off sleep aids and draw upon their own internal resources to feel better mentally and also to optimize their sleep. So I'm doing this in my private practice setting.
So how do people find you normally? Do you get referrals from insurance or is it word of mouth? What happens?
Because this is an integrative practice, it's an out-of-network practice, so we don't take insurance. And the reason for that is because in the insurance system, you're very limited by time. And so you don't have the opportunity to really go in depth into ways that are really going to heal people, and looking under the hood and looking at the causes of their symptoms and so forth. So I do a 2-hour intake with most of my patients. Sometimes it goes over 2 hours. And then my follow-ups are usually an hour to an hour and a half. And so it's really not possible to do that in an insurance-based system. So most of my referrals come from word of mouth. So I work with a lot of therapists in the community. So they'll send me patients. I also get patients from primary care doctors in the community. A lot of people also find me on Psychology Today or through Google. So there's a number of different channels that people find me through.
So are you finding that the term integrative psychiatrist is gaining traction, that people have a sense of what you mean when you say that?
You know, I feel like it's still a pretty new and nebulous term. I feel like a lot of people don't quite understand what that is yet. And even in the field of psychiatry and mental health itself, I don't think there's a great understanding of what integrative psychiatry or integrative medicine even really is. There's kind of this, you know, in conventional medicine, there's kind of this bias that integrative medicine doesn't work, or it's not evidence-based, or, you know, it's not, you know, it's some sort of snake oil, you know, selling or something like that. But, you know, I'm in California, so there's a lot of awareness of holistic medicine and integrative medicine out here. But in general, I think it's not fully been accepted into mainstream society yet. And so a lot of people don't quite yet understand what it is.
So how would you differentiate between the traditional medical model, the allopathic medicine, and what you're practicing as an integrative psychiatrist? How would you describe that to people?
Yes, so integrative medicine or integrative psychiatry does not reject conventional medicine. So I think that's a misnomer that a lot of people often believe. So integrative medicine actually blends the best of conventional medicine with integrative and holistic modalities. So for example, it could be looking at a full integrative approach for anxiety could look like using medications when appropriate, using other conventional modalities like psychotherapy, but also looking at nutrition or yoga or meditation or breathing practices, other practices from Eastern medicine as well. So I've done some basic training in Ayurveda. So I bring in those practices into my clinical work in addition to the, you know, conventional approach. So integrative medicine doesn't reject conventional medicine, nor does it blindly accept holistic practices without question. It's really about offering the best tools to our patients in a personalized way that is going to help them achieve optimal healing.
So in the traditional sense, if I refer somebody for an evaluation by a psychiatrist, generally speaking, they'll get, if they're lucky, a 45-minute to an hour intake, and then they'll get a medication prescribed almost just predictably, like lockstep. That's what happens.
Yes.
In very few cases do I refer somebody for an evaluation. They don't come back with a script or multiple scripts.
Yes.
And then the follow-ups are a month, 3 months, 6 months, ad infinitum. It just keeps going. What was that? What does a pattern of treatment or course of treatment look like in your realm?
Yes. So when a patient comes to me, like I mentioned, I'll do a 2-hour intake with them, and sometimes it might go beyond that time frame. And essentially what we do is we go through many things that are involved in a conventional psychiatric evaluation. So we're looking at their medical history, psychiatric history, medications that they're taking, family history, and so forth. But we'll also take a deeper dive into lifestyle aspects that might be contributing to their symptoms. So I focus on sleep. So I do a lot of sleep assessment, circadian rhythm assessment. Sometimes we'll do some testing, functional testing or nutritional testing to see if there are other root causes for their symptoms. We'll also look deeper at trauma or complex traumas that the patient might experience.
Thank you for that. Right. That's so many people, especially the allopathic psychiatrists that I refer people to, don't even ask about trauma.
Yes.
It's like they're allergic to the T word. And you're now, you make it official. Every integrative psychiatrist or medical doctor I've looked at is opening to and focusing on the impacts of trauma.
Yes, and I think that is one core aspect of integrative psychiatry that differentiates it from conventional psychiatry, is that at its core, it truly is a trauma-informed approach.
That's wonderful. I know Dr. Leela Masumi talks about her model is some children are rocks and some are laptops. And I said, what? And she said, well, yeah, with a rock, you can throw it against the wall and drop it in a snowbank and splash it in a river and still functions as a rock. But if you do that to a laptop, it's not going to work so well. And so a lot of people live in a household that most people looking in from the outside would not label this as an abusive environment or a traumatic environment. And yet for a child whose emotional needs don't fit what's available in that household, they can download a lot of energies that are baggage later in life, and that's what we call trauma.
Yes, absolutely. And I think that's a really, really important distinction to make as well, is that everyone responds to situations differently. So you could have, two different kids in the same household, and they could have a completely different experience of what it was like to grow up in that family. And it can affect them very deeply in different ways as they get older. And, oftentimes when we talk about trauma, people think of very overt abuse. And so, I'll ask my patients about trauma and they'll say, oh, no, I had a very happy childhood. But you start digging deeper and then you might realize there were maybe issues with misattunement with their parents that created, very deep-seated feelings of shame or feelings of, internal confusion or, low self-esteem and, all of these kinds of things that carry over into adulthood that may have not been very obvious until you start peeling back those layers.
Yeah. And of course, for my money, referring to somebody who's a functional or an integrative practitioner is so much better, because they'll start looking at that and helping the individual assess things that oftentimes the individual didn't realize this was a problem in my life, or this might be driving my anxiety or my obsession or my depression or my sleep problem.
Yes.
So if we can come back to so then you have a 2-hour session, and then what does a course of treatment look like in your practice?
Yeah, so the course of treatment, is, again, it's very individual. So, in the conventional model, you might have someone get placed on medication, like you said, and then they'll follow up with their doctor every few months, and the medication dose will be tweaked or adjusted. But in the integrative model that I follow, patients will come and see me again, sometimes after a week or 2 weeks or a month, depending on what they need. And in those follow-up sessions, we'll keep digging deeper into, kind of 3 core aspects. We'll look at lifestyle. And as I mentioned, I focus a lot on sleep and circadian rhythm management. So we're really trying to optimize their sleep, because if you're not sleeping well, it's going to affect every other aspect of your health and of your life and functioning. So that's one aspect. Then we'll start digging deep into beliefs or mindset, or trauma, or, ideas of meaning and purpose, and where that might be lacking in a person's life and how those might be contributing to their current symptoms. So we start digging into those things as well. And then the third aspect is kind of the biological piece. So, are there nutritional deficiencies? Is there a microbiome dysfunction? Are there supplements that we need to add in, or specific dietary changes that we need to make? Do they have gluten sensitivity? So those are kind of the 3 core pillars that we look at as we dive into treatment. And the goal is really to get the person to a place where they're functioning optimally and they don't need to see me anymore. I tell all of my patients, I want them to graduate from treatment. I don't want them to be seeing me for 20 years. So I want them to get to a point where they feel empowered to take their health into their own hands and to know exactly what to do when things might slide back a little bit. Sometimes they'll come back and see me for follow-ups for like a tune-up, but the idea is that they should be able to go out into the world on their own and not be dependent, so to speak, on treatment.
Well, and if your caseload or population is anything like mine, when you start asking people about questions like purpose and meaning and life goals, there are quite a few who've never even explored those issues. So it begins with, well, what do you mean by my sense of purpose? Or what do you mean by my life goals? And so that's one of the things I love about, Dr. Mark Hyman's approach to, I heard him in an interview once say that, it's not rocket science what it takes to live a healthy life for a human being. It's these, 5, 6, 7, 8 categories. And they don't just get limited to good, clean water, good nutrition, and sleep. It's all of this sense of purpose in life, connection to community, sense of love. And so when that happens, are there particular tools or resources you use to help people tease that out or point them in different directions?
Yeah, so there's a few things that I do. One is just starting the dialogue and opening up that conversation. As you said, a lot of people haven't even thought of this stuff before. They haven't had the time to think about it, or just kind of like the opportunity or the venue in which they can discuss these things. So one of the questions I ask people is, if you were financially free, what would you do with your time? And sometimes simply asking that question gets people's minds, opening, and it gets their imagination going, and they start thinking, oh, well, yeah, let me take a step back and look at that. And sometimes you'll get some really interesting answers. So that's one way that I start up the conversation. Another is asking them, what used to light you up before you were 10 years old? What could you lose yourself in? What did you love to do when you were a kid? And that also can, sort of, open up people's minds and their imaginations to exploring this. Sometimes I will use tools like the Strengths Finder assessment. And, I work in the Bay Area, so I see a lot of people who work in tech or they work in the corporate environment, and they kind of feel like they're a cog in the wheel, and they kind of get stuck, and they end up in roles that maybe aren't the best fit for them, aren't the best fit for their temperament or just their style. So sometimes some of these tools like Strengths Finder or even the MBTI, the Myers-Briggs assessment, sometimes these basic tools can give people some insight into what makes them tick and how they operate. And that's often a great launching pad to have these conversations and to explore further.
So just to clarify for people, the Myers-Briggs is, some people call it a test, but it's really just a questionnaire. And when someone fills it out, it doesn't tell them right or wrong, good or bad. It just gives a description based on their own report about how they like to interact with the world. And I have found that to be very useful for individuals and couples. There are adaptations of that, the DISC profile and things that people have adapted for work settings that have become very popular. And what I like about, referring to someone like you is that that's not going to be out there as just a data point. It's going to get integrated to your picture of the person. And what can happen all too often in my experience is that people glom onto one thing, like the Myers-Briggs typology indicator, and then either use it as a weapon against themselves or against their partner, and or think that because of that, it rules out certain professions that they might actually have a passion for. So what I'm hearing you say is that you use that in combination with all of the other things you get from your assessment and your ongoing work with people to help them integrate that information to make better decisions.
Yes, and it's really important to not get attached to the outcome, like you said. It's not defining the person's identity, but these things are really tools to help people understand themselves a little bit better and understand, how they make decisions, what's depleting to them, or, vice versa, what gives them energy, how they follow through on goals. That's another thing that I work with patients on is goal setting. And I'll see a lot of people who, they experience a lot of shame, or they're very hard on themselves because they feel like they can never follow through on things. So sometimes these assessments can help us understand, how they operate and leverage their strengths, really is what we're working on.
Well, and one of the things that was so useful to me personally, and then working with others with the Myers-Briggs, was the fundamental assumptions in that work. That number one, everybody has access to both sides of all four dimensions. It lets us describe ourselves according to four different dimensions. And so everybody has access to both sides of every dimension. If I test out as a feeling kind of person, I can also develop the thinking aspect of things. If I test out as an introverted person, I can develop the skills of an extrovert, etc. The second thing is that everybody, in quotes, almost everybody is going to have a natural tendency toward one side or the other on all four dimensions. And the last piece that's so critically important, especially in a society like ours, is that the more stress I'm under in any given situation, the further I'm going to move toward the extreme of my natural tendency. And those of us who work with people know extremes are not really useful. Doesn't matter how good it is in that moderate range or in that high level skill range. If I go to an extreme in it, it gets to be dysfunctional. And just those key pieces to help people understand, well, you know what? When things are going along and I'm humming along at a low to moderate stress level, I can do this, this, and this. But if I get into a situation that I interpret as a high stress level, I need some different coping skills. I've got to be monitoring my own responses and pull it in, or go for the tools that, you know, Dr. Bhopal might have taught me about getting some balance back in my life.
Yes. And you know, and that's why I named my practice intra-balance, you know, to really help people access those internal resources so they can find balance. And I think that's really important. What you just said is that when people are under stress, they're going to go to these extremes. And so you'll see them, you know, completely withdraw or start to numb out with substances, or, you know,
make decisions without good information,
make decisions impulsively, you know, or hide away under their blanket and
be unable to make a decision
sleep.
to save
Yes.
their life, right?
Yes, exactly. So the goal with integrative medicine or integrative psychiatry is to help people maintain that sense of balance so that they can be functional and function optimally in all aspects of their life, not only with their physical health, but also in their relationships, at work, with their families, and so forth. And so, you know, when they go out, you know, into these extremes, my goal is to teach patients what to do to bring themselves back into balance so that, you know, they don't have to rely on taking a Xanax or, you know, calling me for a crisis appointment or something like that, that they have all the resources and the tools that they need to keep them in a state of balance.
Yeah. And just hearing you say that, it resonates for me that so many people have everything they need, and they just don't know it. They haven't been taught it. They don't know how to access it, but it's right in there.
Yes.
And, you know, one of the keys in work for me, and a lot of the things that really work, is helping people understand that their emotions are just energy, and they're just really good sources of information.
Yes.
They're not something to be run away from or drugged out. And that is a relatively unique perspective in our culture. So I'm hoping that in your practice, you do the same, helping people in this intra-balance become aware of their emotions and learn to use them more productively.
Yes. And so one of my favorite tools that I use in my practice is a really simple tool, but it's just an emotion vocabulary list. So it's literally just a list of different feelings and different emotions, because most of us are not taught how to identify our emotions, right? So we know that we don't feel good, but you know, a lot of us have difficulty articulating what it is that we're feeling exactly. So one of the things I do is I use this tool, and I will have people start, you know, journaling on what they're feeling. They'll refer back to the tool and really pinpoint exactly what emotion they're experiencing. And I love how you said it's information, because that is simply all it is. It's not that these emotions are good or bad, or that we're trying to achieve any particular type of emotion. All of these things are information that we can use to then, you know, achieve our treatment plan.
Yeah, it's so interesting. I remember I've worked with a number of people who had the experience growing up that they were just told to shut it off or dry it up, or I'm going to give you 1 minute, and if you don't stop crying, I'll give you something to cry about, and etc. And so the teaching has been, this is a bad thing. This is something I need to run away from. This is something I can't handle. This is something my parent can't handle in me. And the more I have those emotions, and I get the signal from the environment or my parent, that whether it's true or not for the parent, the child interprets it as, oh, my parent can't handle this. The more I form the belief there's something damaged in me, there's something wrong with me. And so for a lot of my patients, that's a primary piece of education, self-education.
Yes. And that self-education is incredibly important. And then coupling that with self-compassion is incredibly powerful. And, helping people understand that, you can experience the emotion without it being overwhelming. You don't need to be scared of it. And so, that's a really powerful piece. And bringing in that sort of mindful awareness and that non-judgmental awareness of their emotions
And
is
the breath.
incredibly important. And the breath work and regulating your nervous system with the breath and using whatever tools work for that person. So I'll have a lot of patients tell me they feel more anxious when they do breath work. So, if that's the case, well, let's try something else. Maybe let's try progressive muscle relaxation, or let's try some yoga poses, or maybe let's try some Tai Chi, or whatever, whatever works for that individual. And that's also the crux of integrative medicine or integrative psychiatry, is finding what works for that individual. It's a very personalized approach.
Well, and I've run into several people recently where they say, people tell me take a deep breath and it doesn't work. And I'll ask them, so tell me, show me, what does your deep breath look like? And they'll go, and
yeah.
I don't feel any better.
Yes.
And I say, okay, well, try this breath. Try where you pull it in, hold it for 2 or 3 counts, and then actually resist the exhale. So the exhale is 4 to 8 times longer than the inhale. And in that extended exhale, my body gets this irrefutable signal. This is not life and death. I don't have to go to fight or flight. And people notice that parasympathetic response kicking in. And so a lot of it is, as you just said, some people, even that doesn't work really well. So we have to add things like, the acupressure techniques of EFT tapping, or the yoga poses, or, the jumping jacks, get up and get some vigorous exercise in. But most people can find benefit unless their system's been completely hijacked because of trauma or because of chemical imbalances in nutrients and hormones. But so how do you know when somebody is ready to fly without you, to not have any more sessions? What kind of assessment goals do you have for yourself working with someone?
Yeah. So, well, if I may, I'd like to share the story of one of my patients who
Sure.
is kind of at that point now. And so this is a person who is in her 40s, and she's been in the psychiatric system for many, many years, since her 20s, and was diagnosed with bipolar 1 disorder with psychosis, and had been on very heavy duty antipsychotics and mood stabilizers for, several decades. And, she'd come to me because she was just tired of taking medications, and tired of feeling like a zombie, and tired of feeling numbed out and not being able to access her emotions, under these layers of very heavy doses of her meds. And so I've been working with her for a few years now, and we uncovered that her symptoms were primarily related to several traumas that had never been addressed. And so these sort of manic episodes were actually more dissociative or trauma-related episodes. So what we did in our work together was, one, I had her start working with a trauma therapist for a very specific trauma protocol called EMDR. So she started doing that. We also started looking at nutrition and bringing in principles of Ayurveda, circadian rhythm management, which is very important for people who cycle or have sort of, manic or depressive episodes, or changes in their sleep patterns. So that's very powerful to regulate their circadian rhythm. And we also started working on nutrition and supplements and gut healing. And so over the course of the past couple of years, she has completely tapered off medication. She has not had any dissociative episodes, no mania, no depressive episodes. In fact, she feels more alive than she has felt in decades. She's working again. She started her own company, and she feels amazing. And she has been so touched by this experience of healing that now she herself is training to become a holistic healer. So she's at a point now where she's not only stable, but she's thriving, and she's healthy, and she is, functioning at her best in every aspect of her life, in her family life, her work life, in her relationships, friendships, and so forth. And so that is the point now. We're at the point now where we're looking at terminating treatment and just following up as needed. So that is the goal. So when people are feeling better and feeling, that they're functioning at their best in every aspect of their life, that is often the time that we can start to wean down on treatment.
Excellent. Well, I am very glad that you shared that story. I'm one of those people who's been at this so long that I've had so many experiences where people came to me with a diagnosis that the traditional psychiatric world would say, this is a life sentence. This is a chronic, progressive problem, whether it's the bipolar disorder or several of the personality disorders. And yet, with all of those different things that you were mentioning, usually beginning with the trauma work and then building their skills in various tools, whether it's the gut biome and nutrition, exercise, purpose in life, people end up going years without any symptoms of this supposedly terminal, chronic, progressive disorder. And so I do also know some people who just, no matter how hard they try, they've not been able to go off medicine and still function. And so the medicine plays a role in those people's lives. I wanted to mention that Dr. Peter Breggin has written a book titled Psychiatric Drug Withdrawal, a guide for prescribers, therapists, patients, and their families. So this is a book that anyone can read, and it's so critical to do the withdrawal of those medicines very, very carefully and sometimes excruciatingly slowly, depending upon the individual. One of the key things from that book with Dr. Breggin is there's no schedule you can write up and say, well, if you're taking 200 milligrams of this drug, then you decrease by 25 milligrams for the first month, and because that might work for some people, and it might also send somebody back into a rebound that's completely debilitating.
That's absolutely right. There is no one size fits all when it comes to tapering drugs. And, so I'm also a sleep specialist. So I see a lot of patients in my practice who have been taking benzodiazepines or Z drugs like Ambien or Lunesta for years upon years. And, these drugs were never designed to be taken for years on end. They were designed to be taken for maybe 2 weeks at a time for situational stressors or just taken intermittently. So I have patients who have been taking these things every single day for years. And what happens is once you're on these drugs, you need these drugs, right? So if you're taking something for sleep and you're taking it every night, you're going to need it every night to sleep. So, I've had patients taking, I had one patient, for example, who was on Klonopin for about 10 years. And, we did a taper over 18 months. And we were going down by really, really tiny doses. And we were using, liquid droppers. And at one point we had to use a compounding pharmacy to get these really, really tiny doses. I think at the tail end, he was on like 0.05 or 0.025 or something, minuscule. But doing these slow tapers in conjunction with looking at all of the other pieces of the puzzle. So, that's kind of how I explain it to patients, is that it's like a jigsaw puzzle. So we want to make sure we're looking at the nutrition piece, the microbiome piece, traumas, meaning and purpose at work, community, looking under the hood and making sure there's no sleep apnea or restless leg syndrome or thyroid dysfunction or other medical issues that could be contributing. So if we look at all of these pieces while doing a very slow taper, the rates of success are incredibly high. And most of my patients who taper off of these, benzos and sleep drugs, they tell me they feel better than ever. They're sleeping better than ever. They're less anxious. They're more able to function at work. Their concentration and cognition is much better. They feel great. And they don't want to go back to those drugs once they're off of them.
Well, and as we talked about, those drugs can serve a purpose if somebody's in a crisis. And at the same time, my approach has been the shortest period of time, the smallest amount of medicine to get the desired effect. And when you have somebody who's going to help you with the skill building and the intrabalance approach that you're providing, all these various aspects of your life, then it's a very reasonable thing to do to build strengths in other areas. And then I don't need that medication support, which, you know, as Dr. Bregan is one of many who's pointed out, Dr. Whitaker is another one who's pointed out that the long-term effects of those medications are almost always negative, and they're not intended. Even the antidepressants aren't intended for this long-term use that we've grown into in our culture.
Yes, yes, exactly. And I think the great irony is that oftentimes the medications start to cause the very symptoms that you were trying to treat in the first place.
Yeah, I was going to say that every time I've read the labels and warnings that come in with people and they have the most common one is either depression or insomnia. And every drug I've ever written, the warning labels on for insomnia says it's for short-term use only, and one of the primary side effects is it causes insomnia if you use it too long.
Yeah, yes.
Well, I mean, how does that make any sense?
Right, right.
And yet, as you say, you've got people who come in and they've been on Ambien every day for years.
Yes. Yes. Yeah. And, you know, and I think it's no one's fault really, you know, I don't want, you know, the patient or the person to, you know, feel judged or blamed for being on these medications. And, you know, I think it's a product of our healthcare system. You know, people will go and see their primary care physician. They have, you know, 5 or 10 minutes to talk to them. They'll tell them about their sleep issues, and then they get put on the drug, and then it's just on their record. It just gets renewed, you know, every month. And now it's 10 years later and they're still on that medication because we just don't have a great system of healing, right? So, you know, our system is really set up for acute management, but not for long-term healing. Yeah, and that's where the integrative approach is really important.
Well, and I would add to that, you know, I don't want the patients to generate guilt or shame, because in my work, I understand those are not useful.
Yes.
And I don't want the doctors to get blamed and hammered because they're only doing what they were trained to do.
Exactly.
I had the privilege of interviewing Dr. Jody Skillicorn, and she talks about, and she wrote in a book, you know, Healing Depression Without Medication. And she talked about how she got out of medical school and was so excited to be a psychiatrist. And then she read Dr. Whitaker's book and said, wait a minute, is there that much evidence that these medications long-term have all those negative effects? And it was only after she'd had the full psychiatric stamp of approval from the establishment that she got introduced to something that said, you know, there might be another way to look at this.
Yes. Yeah, no, and that's absolutely right, because, you know, we're not, as doctors who go through training, we're not exposed to these other ways of healing and these other ways of thinking about health. You know, we're really taught how to reduce symptoms, but we're not taught how to optimize health and well-being. And for me, it was through my own work with yoga and meditation, my own personal kind of journey with that I started to realize that, wait a minute, there are other ways, there are other dimensions to health and healing that we're not addressing in the conventional system. And so that's kind of what got me really interested in learning more about Ayurveda and holistic medicine. I was a skeptic before, you know, I was like, no, I'm a scientist and those things don't work. And, you know, that there's no evidence for them. But it wasn't until I had my own personal experiences with those healing modalities that I started to understand firsthand what they could do.
Well, and there's another psychiatrist we've interviewed for the On Your Mind podcast who was practicing for years as a psychiatrist, and then she had her own internal physical pain that conventional medicine was completely unable to identify or give her any relief for. And she said, as she was telling her story, that at the point where they finally gave up, they couldn't figure out what was causing it. And they suggested that she let them just inject nerve blockers or painkillers directly into her abdomen. That's when she said, this is just not working. And that was her U-turn to go toward a more holistic alternative approach. And when she started to find things that worked for her, then she just felt compelled to offer them to her clients and patients. And now that's her practice, is, you know, functional, integrative, holistic approach. And it's nothing that she learned in her medical school training.
Right. Right. Yeah. Yeah. And, you know, another aspect of that that's so interesting is that patients intuitively know that all of these things are connected. So for example, I have a patient who has a lot of autoimmune issues. She's got autoimmune thyroiditis, Hashimoto's, fibromyalgia, she's overweight, she's got fatigue, she's got chronic depression, there's a history of trauma. And she understands at a very deep level that all of these things are interconnected, yet she's seeing like 4 different people, right? So she's seeing like an endocrinologist and then a rheumatologist, and, she's got her therapist, and, she's got all of these different people in these different silos who don't talk to each other on her treatment team. And so when I explained to her that in Ayurveda, which I see as the original functional medicine, in Ayurvedic medicine, it's understood that all of these things are connected. And we looked at sort of her symptoms under the umbrella of Ayurveda, and looked at what the root cause might be in terms of a root imbalance. She burst into tears because it was so validating for her to hear that, because it's something that she understood very deeply personally, but none of her doctors believed her. She's asked her different doctors, could these things be connected? How might they be connected? And she's been told, no, they're not. They're separate conditions, and so you have to treat them as such.
Yeah, and again, if the doctor has been trained to believe that, and they've got what they consider to be the evidence, the facts, the scientific proof, it's very difficult to convince them otherwise.
Yes.
It was Dr. Phyllis Hefner that I was mentioning, who's a child psychiatrist, that had that story about her own illness. And I believe that Dr. Mark Hyman has a similar, he's a very prominent name in functional medicine. Yes. He has a very similar story of being a physician and having his own physical problems and running into brick wall after brick wall in conventional medicine. Basically, they're just telling him, you got to go home and take these meds and write it out, because this is never going to get better. Yes. And he refused to accept that. And that's what turned him toward the more holistic alternative and eventually the functional medicine approach.
Yes. Yes. And there's a real feeling of helplessness that is kind of built into the system. And, patients feel helpless, but so do doctors. In the conventional system, as doctors, we're just trained to use medications or, maybe a few other modalities. And then when we run out of those, we're kind of stuck. So this idea of helplessness is kind of baked in to the Western medical model. And that's what's so beautiful about functional medicine or integrative medicine, Ayurveda, traditional Chinese medicine, is that it's really about empowerment, and it's really about balance and giving people the tools to bring themselves to that state of balance. And so if you can, if we can create that mindset shift with our patients from the state of helplessness to empowerment, like with my patient that I told the story about, who was diagnosed with bipolar disorder, who had multiple hospitalizations, who was told she's going to need to be on these meds forever, she's never going to be able to work. I mean, how helpless would you feel hearing that? And so now she's in this, state of feeling empowered. And if we can do that for our doctors and for our healthcare providers, at a system level in Western medicine, can you imagine how powerful that would be for our society?
Well, and that's a big part of what Journey's Dream is trying to promote, the idea that optimal health and well-being is possible, and you could learn to expect that of yourself and your physicians and your health team, if you want to term it that way. So I realize we're closing in on time when I have to get going here, and I wanted to give you an opportunity to let people know how to contact you, whether or not you do any telehealth work for people that aren't in the Bay Area, and or what's an aspect of your work that we haven't even touched on yet that you would want to put out there?
Sure. So, people can find me on my website at intrabalance.com. That's INTRA balance.com. I do have a free holistic sleep guide that people can download. So that's at intrabalance.com/sleep guide. I do offer telehealth sessions for people in California For people outside of California, I'm actually putting together a holistic sleep program. That's a step-by-step program that teaches people holistic ways and integrative ways to optimize their sleep quality. And so this will be available to anyone. And that will be coming out in January of 2021. And so for more information on that, people can get my sleep guide, and then they'll get email updates about the program. So sleep is a huge part of the work that I do. We sort of touched on that a little bit, but that's what I'll be focusing on next year.
All right. Wonderful. Well, I thank you so much for taking the time to be with us. And I look forward to watching how this develops, you and your sleep soul sisters, as yes. They put together this program. If I'm right in that, that's Deepa and Arthi are with you in that project?
That's right. Yep. That's the three of us. Yep.
Excellent. Well, thank you so much. I appreciate your taking the time, and it's a pleasure to meet you.
Thank you for having me.
Dr. Nishi Bhopal is triple board certified in psychiatry, sleep medicine, and integrative holistic medicine. She graduated from the University College Cork School of Medicine, completed her psychiatric residency at Henry Ford Health System, and a fellowship in sleep medicine at Harvard Medical School. She also received training through the Maharishi Ayurveda Association of America and the Integrative Psychiatry Institute. Having grown up in an Indian family in Canada and lived in several different countries, Dr. Bhopal understands what it means to be multicultural and is attuned to the unique challenges faced by immigrants and expats. She's also a meditator and brings her experiences with yoga and meditation into clinical practice, blending the best of ancient wisdom and modern medicine. Dr. Bhopal is the founder of IntraBalance Integrative Psychiatry and Sleep in San Francisco, and is a founding member of the Same Here Psych Alliance, a global initiative to reduce the stigma around mental health. Her passion is making mental wellness and the science of sleep easy to understand and accessible to all. Her website is intrabalance.com, INTRABALANCE.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.